Welcome. I've been honored to moderate this annual Behavioral Health Legislative Forum now for well over a decade, and I'm delighted to be back here once again in our new setting, which is a whole lot different from Seattle Center. I invite you to listen to our podcast, Recovery Coast to Coast, featuring prominent people in recovery, including singer-songwriters Judy Collins and Bonnie Raitt, authors Anne Lamott and Brene Brown, Buzz Aldrin, second man to walk on the moon, plus everyday people in long-term recovery, sharing their path, their inspiration. And following tonight's forum, I will put together the highlights from this year's forum and feature them on a future podcast. I'd like to formally welcome everyone, legislators, elected leaders, special guests, and recovery community members to this annual celebration of our community's commitment to behavioral health and recovery. Everyone should celebrate recovery because, as my hat says, recovery rocks. Recovery is as recovery does, and if at any time you would benefit from respite or peer support, please feel free to visit the relaxation room. It's right near the elevator in the lobby. It's a good place to find some quiet or maybe take a break this evening. First off, a hearty thank you to the 18 ambassadors of this year's forum, each of them bringing at least 5 people tonight, and this includes provider agencies, advocacy organizations, peer groups, and many other community partners. Thank you, ambassadors. You make this whole thing work. And of course, we're delighted to welcome so many of our state legislators and county council members seated here on stage. We're going to meet them here in a few moments and share their thoughts a little later on in the program. Several legislators could not be with us tonight, but they are represented by staff. They are in the audience. Legislative aides in attendance, Emily Grupp, Office of Representative Jerry Pollitt, Madeline Cavazos, Office of Councilmember Claudia Balducci in the 6th District, Cody Eccles, Office of Councilmember Reagan Dunn, that would be in the 9th District. I love this name, Sunshine Chang. Sunshine's with the Office of Representative Daria Farver in the 46th District. We also have staff here representing 2 members of Congress, and we ask them to please stand and be recognized. Thank you to Josie McKinley, representing Senator Maria Cantwell, and Bailey White, representing Congresswoman Suzanne Del Bene. Big round of applause. And finally, we are joined by many local elected officials, including judges, city and town mayors, and local council members from across King County. And we ask you to please stand and be recognized. Thank you to all local elected officials here this evening showing your commitment to behavioral health. And let's get started by welcoming Susan McLaughlin to the stage. Susan is the Behavioral Health and Recovery Division Director at King County. She is a licensed clinical psychologist with more than 20 years of experience in healthcare, behavioral health, social services, and in her role, she oversees behavioral health treatment for the region. A big job, she does a great job. And tonight, she's here to talk to us about King County's behavioral health legislative priorities. We've had many accomplishments over the years in King County, but there is so much more to do. Please welcome Susan.
Thanks, everybody. Wow, this is amazing. What an incredible turnout. Thank you all for being here, and thank you, Neil, for that great introduction and for emceeing as you always do. As Neil said, my name is Susan McLaughlin. I am the director of the King County Behavioral Health and Recovery Division, and it's just an honor to be here at the King County Behavioral Health 2025 Legislative Forum. Thank you all who are in attendance. Thank you for showing up, and especially during such challenging and uncertain times. It's by showing up that we are all able to come together and make real impact happen. That's what I'm going to talk about tonight. So I want to give a special thank you to our legislators. Thank you all so much for being here, and all of our elected officials who are showing up to listen, to share their priorities and also to share the realities of the challenging times that we are in. So thank you so much for your ongoing partnership. Really appreciate you. So all of us are here tonight because we believe every person deserves access to high-quality behavioral health care regardless of their background or circumstances. Tonight, I want to kick off by talking about progress because it's important for us to acknowledge how far we've come as we think about the many challenges ahead. Now more than ever, our state and local government action is necessary to protect our progress and keep intact the critical work we do to make behavioral health services and treatment accessible for all. We know that mental health matters, that treatment works, and that recovery is possible. You will hear lots of testimony to that exact fact throughout the evening tonight. This is why behavioral health is worth investing in. In King County, we are working toward a system that is connected, inclusive, and responsive, one that delivers the right service where and when a person needs it. I always like to talk about we're building the behavioral health system of the future. In 2021, our state passed landmark legislation to implement the National 988 system to enhance and expand behavioral health crisis response and suicide prevention services. This was due much to the efforts and leadership of many of the people you see on the stage tonight. One of the first in the country, this legislation set the stage for King County to advance a vision and create the opportunity for a historic investment in our region. And in 2023, the voters of King County agreed with that vision, and with overwhelming support of the Crisis Care Centers Initiative, approved a local levy that is allowing us to modernize and build a crisis response system, funding 5 centers where anyone can go to get mental health and substance abuse care, regardless of their insurance status or ability to pay. In both 2022 and 2023, Washington State also made historic investments in behavioral health, from investments in Medicaid, crisis services, residential treatment, mobile crisis, to capital and operating dollars for permanent supportive housing. These investments have paved the way for more treatment for more people in need. Buildings have opened, mobile teams have expanded, and Medicaid rate increases helped support the workforce. We've made tremendous progress over the last year. Just want to cover a few of those. Last year, outreach to the 988 Behavioral Health Crisis Line increased overall, with over 9,000 phone calls, over 1,200 chats, and nearly 3,000 texts coming in each month. I'll say that again, each month. Crisis care is now available 24/7 today for everyone in King County, regardless of insurance or ability to pay. At the first King County Crisis Care Center, which was established in Kirkland. And this year, we will close on the purchase of a second crisis care center located in the Seattle area as we continue to work to create a network of 5 centers around the region. Yeah. There are more mobile crisis teams, both for adults and for youth, who are responding in person to help people across the county. And we've invested over $16 million in our behavioral health workers around the region to support things like training, recruitment and retention, professional development, among many other things that goes to. King County also made significant progress to slow overdose deaths through investments in our 13 actions to stop the surge of overdoses, an initiative that was launched last March. These strategies include the opening of a new 16-bed residential treatment center for people with co-occurring mental health and substance use disorders, a new place for people to recover from an overdose and connect with resources, and an updated recovery and sobering center in the Soto district that will open next year. With help from our partners at Public Health Seattle and King County, we've increased the distribution of naloxone to our community-based organizations. This is a life-saving overdose reversal medication. We're on pace to double what was distributed last year. We also launched a new buprenorphine prescribing line where anybody can call to talk to a physician and get a prescription for buprenorphine, also a medication to treat opiate use. This telehealth program has served more than 1,000 people to date. I am happy to share that all 13 actions from that initiative are in place, and King County has seen a steady overall decline in fatal overdoses over the last 2 years. And it is because of the collective efforts of everyone in this room that we are seeing those results. By leveraging existing strategies and enhancing the ways people access care, we together are making a difference, and we need to celebrate that. So thank you all. So this year, King County engaged over 2,000 providers, community members, and some of our key partners to inform planning for the future of behavioral health. This included in-person and virtual listening sessions. We had community-based events and online surveys available in 20 different languages. Overwhelmingly, what we heard from community is that people want more access to services and supports. People want more culturally relevant and responsive care, and people want continued progress to meet the growing need for behavioral health care. So as we look toward the upcoming legislative session, King County is urging our leaders in Olympia to protect the care we have and the progress we made. That is why King County's top priority for legislators this year in behavioral health is to protect access to behavioral health care for people on Medicaid. Federal funding cuts and policy changes, including those to Medicaid and permanent supportive housing, are expected to put hundreds of thousands of Washingtonians at risk of losing coverage and life-saving services. Community-based providers of behavioral health care, especially our smaller organizations, are also at real risk of closing and need help to stay open. These federal changes make our behavioral health system more vulnerable and our communities less healthy and stable. Inaction is no longer an option. Our state and our local governments must work together, which is why King County is asking the state to protect access to behavioral health care for people on Medicaid, to strengthen our community behavioral health agencies, and to grow navigator programs that will help people sign up for or maintain enrollment in our state Medicaid program called Apple Health. Similarly, our second priority for this session is for the state to maintain its funding for behavioral health crisis response. Already, King County is facing a significant funding shortfall, including insufficient funding to meet the needs of our state-mandated crisis services. This puts the crisis response as well as the community behavioral health system at risk. Maintaining the current level of state funding is critical, and to the extent possible, we ask the state to provide additional funding to sustain community-based behavioral health treatment, crisis response, and especially services for the uninsured. Our outpatient mental health and substance use services and our crisis response system are the foundation of behavioral health treatment. We have made much progress in the last few years, and it is imperative that we sustain that progress, keep people covered, and not go backwards. Later, I'll talk about additional legislative priorities for this year, including retaining, strengthening, and growing the behavioral health workforce and sustaining permanent supportive housing operations and services. But first, tonight we're going to hear from recovery speakers who will share their firsthand experience with our behavioral health system and the importance of protecting the progress that we've made. So let's get that started. It is my honor to introduce our first recovery speaker for the night, Juju Pearce. Juju is an Indigenous graduate. She's an Indigenous graduate of Interagency Recovery Campus, which is the only public sober high school in Washington. It's also celebrating its 10th anniversary this year. She's part of our Bridges Alternative Peer Group, and she's an aspiring substance use disorder counselor, our workforce of the future. She's a remarkable young woman, and her story is a testament to her strength and community. And so please help me welcome Juju.
Hi, my name is Juju. I'm an Indigenous woman in recovery for almost 2 years. I want to thank everyone here for allowing me to share my story today. My journey with substance use started long before I understood what addiction even was. It has taught me about resilience, community, and the power of support. I'm here to speak about the importance of accessible recovery resources and how they change and save lives like mine. Both of my biological parents struggled with substance use and serious mental health disorders. Because of the complications that came with that, I was placed in the foster care system at a very young age. Eventually, I was adopted by my wonderful parents, and while they provide me stability and I was mostly a happy kid, I also struggled deeply with my identity as an Indigenous child in a white household. I often felt unseen and unfit for my environment. That lack of belonging ended up following me. At the age of 11, I ran away from home to find my birth parents. I thought that reconnecting with them would fill that emptiness, but instead I was introduced to methamphetamines by my birth father. My use wasn't daily back then, but it planted a seed that would take root and grow over the years that followed. The following year, I was arrested. As a part of the process, I was ordered to complete community service and attend therapy at the Cowlitz Tribal Health Center in Tukwila. It was there that my therapist helped me see something I could not yet understand, that some of my behavioral issues were symptoms of a deeper substance use disorder. But because of my age, residential treatment wasn't an option yet, and my substance use disorder was not recognized. I received help, but I wasn't ready to stop. Addiction had already found a home in me. At 14, I went to rehab for the first time. I needed to complete treatment to attend the recovery high school on Queen Anne. The school and amazing staff helped me stay sober for 13 months before a close friend ended up passing away. This loss broke me and I relapsed. What started as a way to cope became the thing that nearly destroyed me. With that relapse, my addiction escalated. I started using fentanyl and meth heavily. I became homeless, cut off communication with my parents, and lived on the streets of downtown Seattle. I want to make it clear that I am a survivor of the fentanyl epidemic. Fentanyl almost took me. Fentanyl almost took me, and it has taken so many people I love. It consumed every part of my life, my energy, my hope, my morals, and my values. It was the only thing that mattered to me. I lost myself completely. I was in an abusive relationship during the time. My boyfriend noticed an abscess on my leg from using and dropped me to the drop-in center. It was there that I met Johnny Ota, Dr. Taryn Hansen, and the staff at UDYC who would change my life. They didn't judge me. They didn't give up on me. Their compassion planted a small spark of hope, even though I wasn't ready to quit yet. One day, I came back to the place I was staying downtown. I saw mice crawling around, overdosed rodents in the garbage can, holes in my face, stolen computer parts, and whatnot. I finally was able to see how I had been living for months. That moment struck me with guilt. I knew I couldn't keep living that way. I called my father and I told him I wanted to go to rehab, but I needed 5 more days before I went. My parents were desperate to help, but they also knew that forcing me wouldn't work. I had to make that choice myself. When I finally went back to rehab, this time at Hazelton, it was different. I wanted recovery more than I wanted to die. When I got out of rehab, I cut ties with everyone connected to my addiction. I got on Sublocade, a medication that continues to help me stay drug-free. I kept working with the wonderful people at Ryther and did almost everything that was suggested to me. I returned to the recovery high school expecting people to resent me, but instead they welcomed me with open arms the same way they had before. The unconditional support reminded me that I was still worthy of recovery and belonging, and that I still had years ahead of me, not to use, but to recover. I started rebuilding relationships with my parents. I began setting goals again. For the first time in years, I could picture a future for myself, and I knew what I wanted. My recovery has taught me that addiction is not a moral failure. It's a disease that thrives in isolation and hopelessness. So many times I wanted to stop. I went to detox, rehab, NA meetings, but I couldn't stop myself. The only reason I'm standing here today is because of the programs who believed in me when I didn't believe in myself, like Ryther, the Cowlitz Tribal Health Center, Hazelton, Bridges. Access to Sublocade and Suboxone and Recovery High School made me make my recovery possible. They gave me support, compassion, and accountability, but most importantly, they gave me an exit route when I was ready to get clean. After getting clean, my life started changing for the better. I took on a leadership role at Bridges APG, which helped me learn accountability and what it meant to show up for others. A big part of my stability has come from the community at APG and Recovery High School. Sublocade's been a consistent and reliable part of my recovery that's helped me stay grounded and focused. At almost 2 years clean, my life looks completely different. I'm a trusted and respected person in my community, and I have the chance to share my stories with others in a positive light. I'm able to hold a steady job and spend real peaceful time with my family. I enjoy my normal problems, now the kind that come with living a stable, honest life. It's the small moments like dinner together that remind me how far I've come. I can now envision myself in a place where I can help other people just like me and show them that it might not feel so, but it's normal for us. My story is just one of millions, but I hope that it shows what's possible when people are given the chance to heal. Thank you for listening, and thank you for continuing to make recovery possible for more people like me.
Wow. Legislators, that is what recovery is all about. Thank you very much, Juju, for your courage tonight, sharing your story, and congratulations on your journey. Recovery is the journey back to self, and it's living proof you don't have to die for a drink or a drug. Next up, we're going to hear from Karen Brady. Karen's the executive director and CEO of Ryther, a behavioral health agency serving young people. She's also a leader on the executive committee of the King County Integrated Care Network. Now, this is really unique. It's a first-of-its-kind public-private partnership between behavioral health partners and King County, and it's built on mutual goals of improving equity, access, and quality care for all King County residents. Please welcome Karen Brady.
Hello. I feel very privileged to be invited to speak tonight, and especially to speak right after Juju. It's kind of that's a big speech to follow. This annual event is a great reminder about the value, for me, a reminder about the value and importance of a strong behavioral health network and the value of partnerships. Partnerships between agencies, partnerships with our elected officials, and partnerships with those we serve. As the executive director of that small pediatric agency, the importance of partnerships cannot be overstated, and there are many partners for Ryther in this room, and hello you all. Partnerships allow us to both focus on excellence and amplify our strengths. At Ryther, our partners help us eliminate barriers to those we serve, just like you heard from Juju. They help us help the folks that we serve get critical life needs met, like housing, food, medical care, and more. Like Juju, partnerships make a real difference in the lives of those we serve because those partnerships weave together a unique set of services that are specific to each individual. As a member agency in the King County Integrated Care Network and a participant in the executive committee, I know that KCICN is built on the ideals of partnership, bringing together the entire community of behavioral health providers to amplify the strengths of members while working towards a behavioral health system that meets the needs of anyone seeking services. As a member, Ryther has benefited from many of the county initiatives around workforce support. Intensive trainings on evidence-based practices for our clinicians, thank you, Dr. Brian. Wellness benefits for our staff, stipends for our interns, and bonuses for employees who provide clinical supervision. These are investments that Ryther could never afford on our own. And they have reduced our turnover and improved recruitment, which ultimately benefits the young people that we serve and, and their families by allowing for greater access to services and predictability in their therapeutic relationships. Johnny can speak to predictability in therapeutic relationships. As members of KCICN, we have also benefited from improved Medicaid rates and from incentives for improved performance. As a small agency within King County Integrated Care, we benefit from back office too. This is a big thing that I talk about, that the county provides, negotiating contracts with the Medicaid managed care organizations, collecting and submitting our service data, and paying predictably on time, which is essential for small agencies. These things improve our negotiating position, avoid an increase in our back office, and help us navigate a challenging financial environment. Being a member of KCICN, Ryther's voice is amplified at a time that is critically important. With the upcoming funding cutbacks, the recent gains made in funding for behavioral health must be maintained, as Susan talked about earlier. As important partners, I also want to give a shout out to all of our elected officials here tonight who have made behavioral health a priority both in budget and in policy. However, stable funding is essential to maintaining current services, and I know everyone here feels that. Our collective voice can be used to heighten the importance of the need to complete the behavioral health rate study to inform fair future payment levels. Those collective voices can also remind our community and legislative partners of the importance of the Children and Youth Behavioral Health Work Group's recent gap analysis and the strategic plan to improve pediatric behavioral health in our state, which I think is a critical need. The voice of many is stronger than the voice of a small pediatric agency. The people we serve, that we all serve, have extraordinary strength, like you just saw with Juju, resilience, and persistence. As a behavioral health network, we should and can reflect those same attributes. When we work together in partnership, we can do just that. Thank you so much.
Thank you, Karen, for shedding light on your work with King County's young people and the innovative integrated care network, bringing better access to behavioral health. Next, we're going to hear from some of our state legislators and county council members here on stage. We're going to pass the microphone around, and we're going to ask folks in the first row to introduce yourself and then respond to one of the following questions. What are your thoughts on something you've learned here tonight? And what are your behavioral health legislative priorities for 2026? We ask that you take about maybe a minute or so each. And we'll start with Representative Scott.
My name is Shaun Scott. I represent the 43rd Legislative District in the Washington State House of Representatives alongside my seatmate Nicole Macri and Senator Jamie Pedersen. Periodically in the State House of Reps, as we are getting ready to deliberate on bills, tax policy, spend policy, et cetera, we are made privy to polls that are taken by our House Democratic Caucus that indicate the popularity of various issues across the state of Washington. If I recall correctly, behavioral health and supporting behavioral health was the first or second most popular statewide issue that House Democrats could have supported on. In other words, there were no other issues that were more popular than the one that we are gathered to discuss today. It is something that I've seen, and we can clap for that for sure. It's something that I've seen with my own two eyes, and earlier this year, using office resources the best that I could to help support the placement of the Behavioral Health Crisis Care Center in Capitol Hill. There was some pushback from some small businesses in the community who did not understand exactly how valuable this would have been to the community. And so the question that I think we should be asking ourselves, and I promise I'm going to answer the question swiftly here, is if this is such a popular issue statewide, and we know it is a popular issue within many of our individual districts, why have we not necessarily seen the kinds of progress that we should have liked to have seen on this issue? I do believe that the federal budget situation has something to do with it, but I do think that there's a little bit of passing the buck there. The fact of the matter is that massive corporate lobbies have spent this year alone upwards of $2.1 million to influence the state legislature against progressive tax policy that would fund some of the programs that we're discussing tonight. And when we talk about sustaining levels of funding in the face of federal divestment, when we talk about what it looks like to step in the middle of a federal austerity budgetary regime, that is revenue, revenue, revenue. There is no way to make that happen if you are unwilling to tax the ultra wealthy in this state in order to make those programs happen. So to answer the question, there are a couple of bills that my office is working on right now that are relevant to this conversation. The first is a major revenue bill that we'll hear about at some point in the next couple of weeks that is designed to plug up holes that have been created by the federal divestment. And the second is, if the state of Washington is not going to do our part to make it so that counties can do what they need to do to fund these programs, counties at present are not allowed to raise their own business and occupation taxes. That is something that can change, and that's going to be something that my office is going to be working on this year to support all the service providers, people who are in need of support, recovery services, because you know that this is about as vital of an issue as we could be discussing at this time.
Good evening, everyone. My name is Nicole Macri. I use she, her pronouns, and I also am just so honored to represent the 43rd Legislative District in Seattle. It is really great to be here tonight. I have learned a lot this evening in connecting with colleagues here who work in behavioral health. I've heard exciting things about what's happening at 988. I've heard from constituents about the fears that they have about both federal bias against marginalized communities and how that intersects with access to behavioral health and the need for the state to stand up. In the legislature, I do a lot of work on our state operating budget and particularly on healthcare and housing. In particular, I have really focused on increasing investments in behavioral health. I really appreciate this agenda that's here in front of us, and I'm intimately familiar with every single item on here and have some follow-up questions for King County folks as well as folks working in the field about a few of these issues. I, too, am working on a revenue bill to help stabilize our behavioral health crisis system in particular, and I'm looking forward to the work on that. We have done a lot to invest in behavioral health crisis services, but we know we are nowhere near meeting the demand. And we know with shifts in federal policy and cuts in federal funding that we expect to see more people coming to crisis services, either mobile crisis services, calling our hotlines, or showing up at the crisis care centers that we have available and that we are planning to open in the coming years. And so those are a few issues. I have been a big champion around expanding access to long-acting injectable buprenorphine and other medications for opioid use disorder. These are life-saving medications, and we need to make sure that they continue to be available, and I'm particularly focused on how we can expand access to those medications, not just in our behavioral health community clinics, but in our child welfare system and in our prisons and jails. So those are a few things that I'm working on.
Good evening, everybody. I am Jamie Pedersen. I also represent the 43rd Legislative District, so that's the middle of Seattle. And I currently serve as the majority leader in the Washington State Senate. I am struck as I read the priorities that you have here by the verbs: protect, sustain, stabilize, resolve, continue. How many of you think that what we're doing is enough right now in terms of investment? And yet, I mean, it's a pragmatic agenda, right? But we know that it is not even remotely adequate to meet the tidal wave of behavioral health need that we all see every day in our streets, in our communities. So my priority for this next session is to turn the ship around in terms of our broken tax system so that we have enough revenue to make these kinds of investments in the people of our state. Thank you.
Good evening, everyone. My name is Manka Dhingra, and I represent, thank you. And I represent the 45th Legislative District. I am so glad we had all the conversations about taxes and revenue, because that's what we're dealing with next year. And it's not just about the money and the revenue, because they impact real people, and they have really drastic negative impacts on people given what's happening at the federal level. And I want to be very clear that the policies at the federal level come from a place that is based in, frankly, either indifference or worse, simply being evil towards people, because that is the consequence of what we're going to see. We're going to see dramatic increases in the number of uninsured individuals in the state of Washington. That is the reality. We're not in a position to backfill all the insurance or all the individuals who lose their insurance in the state. But what we can do is make sure that we are looking out for each other the best way that we can, which means each and every one of us is going to have to take that responsibility to look out for our neighbor, for our friend. And I do want to say that, Senator Orwell and I were so adamant that when we passed the 988 bill, that we put in a fee to pay for that crisis system. That fee is going to make sure our 988 system remains the way it is. And I don't have to tell you how critical that is. I am so very proud that every time I talk about our 988 system nationally, we have one of the highest rates of phones being answered in the state of Washington, which is incredible. But we know we have to build on that system, and so I don't want us to lose momentum, but I want us to make sure we continue down that path in creating the system that each of our loved ones deserve to go through if they need that help. So I look forward to supporting all these revenue ideas and making sure that we in this Washington take care of every single person, no matter where they come from, how they identify, or who they are.
Good evening, everyone. I'm Roger Goodman, and I'm also from the 45th Legislative District. It looks like the 43rd sticks together, the 45th sticks together. I actually want to say hi to Neil, because 20 years ago, 2005, wow. I was the legislative liaison for what was called the Alcoholism and Substance Abuse Administrative Board at the time. I guess it's the Behavioral Health Board now. So I've been involved in this work for a long time. I actually was in charge of putting this event together, which attracted maybe a dozen people in a small church. No, seriously, this is amazing. There's never done a better job, particularly the resources out in the hallway. A+, incredible job. So at that time, I was working for the King County Bar Association to end the war on drugs, and I'm still working on that. We have cranked it down quite a bit. Echoing Susan McLaughlin's remarks, think how far we have come. It was just a dozen people in a church 20 years ago. Now, the stigma really is wearing away, and families care, and we want to go public about this. And also think how far we've come in terms of the legislature, acknowledging that behavioral health really needs to be right in the middle of our radar, and it has been. We have a long way to go, but we have come a long way since, despite the budget challenges and the political and cultural and economic challenges facing us. So thanks all of you for standing up for those you love, and also for coming here tonight.
It is my absolute honor to recognize tonight someone who has given more than a quarter of a century to that very cause. Our colleague, our leader, and our friend, Nancy Dow, you can stay seated over there, Nancy, right now if you want. Nancy likes to say that she's been on the Behavioral Health Advisory Board since before there was dirt. And in some ways, that's actually true. Nancy joined what was the Mental Health Advisory Board, the partner to the Alcohol Advisory Board. She joined it in 2002, long before it ever was what it is today, which is our Behavioral Health Advisory Board. She was the first peer to ever serve on the board. She also chaired the board in 2007 and 2008, And when the moment demanded it, Nancy stepped back into leadership in 2020 and has been the chair for the past 5 years. She has served alongside 5 different King County division directors. Hopefully I'm the last, Nancy. Coached recovery speakers for our forums, and even turned her dining room into a recording studio when the forum had to go virtual. Through transitions, recessions, and years of staff, leadership, and membership turnover, Nancy has kept us together. Our board members often ask, how do we really make a difference? How do we influence policy in a system as large as King County? Nancy's career is one of the answers to that question. She was there when the Legislative Forum began in the 1990s, an event, as you just heard, that started in a church basement with 4 sponsors and our esteemed Neil Scott, who's still emceeing this today. We're so grateful for him. And it has grown into one of the most important advocacy gatherings in our region. I mean, look at tonight is just a testament to that. Nancy was there when the local mid-behavioral health sales tax was first proposed back in 2007. Our county staff, of course, couldn't advocate for it, but the advisory boards could. And Nancy was the first peer chair, walked that tightrope with courage, showing up at every event, encouraging others, and helping secure what was, at that time, the largest infusion of behavioral health funding in our county's history. She was there when marijuana was legalized in 2012, ensuring that tax revenue would be directed toward prevention and treatment. She was there on the Harborview Leadership Group in 2019, which made recommendations for how voter-approved bond funds should be used to improve the hospital, including improving behavioral health care, sitting alongside CEOs, council members, and medical directors, and reminding them what it means to sit with a client in a psychiatric emergency who has been waiting for hours on a gurney and in restraints. That moment of speaking up, Nancy says, was life-changing because it affirmed for her that peers and lived experience matter in shaping the future of behavioral health treatment. Nancy has also been a pioneer in the development and growth of peer support. For 21 years at Harborview, she worked as a peer specialist. She was one of the originals. She helped launch the Peer Bridger program, which helps people transition out of hospitals back to community, turning an idea she once heard from the board table into a reality that she lived every day with the clients she served. Nancy has seen the system from every angle, from providing direct services to clients to the decisions about how the services will be paid for. And through it all, she has never lost sight of the people at the center, people in recovery, working harder than anyone, proving every day that recovery is real. What makes Nancy extraordinary is not just her resume, but her spirit. She has carried this work through bureaucratic hurdles, through budget battles, through moments when it seemed the system itself might falter. And yet she kept showing up and showing us what it means to lead, to serve with integrity, and to never give up on the possibility of recovery. Nancy's official last meeting as co-chair of the Behavioral Health Advisory Board will be this December. But we know she won't be far. She will continue to advise, mentor, and inspire the next generation of board members, as well as the people who continue to serve, especially peers. So tonight, Nancy, we don't just say thank you. We say, Nancy, your legacy is woven into the very fabric of behavioral health in King County. Your leadership has shaped policies, your compassion has touched lives, and your courage has opened doors for peers who will follow in your footsteps. On behalf of this community and the thousands of people whose lives are better because of your work, we thank you. Thank you for your service, your wisdom, and your heart. Congratulations.
Thank you so much, Susan, and to Nancy for your extraordinary service over many, many years here in King County. Our next speaker is Hussein Ugas, Hussein is the founder and executive director of Rama Recovery Center down in Federal Way. If you're unfamiliar with it, it's a level 2 accredited, culturally informed recovery residence serving East African and Muslim communities. A survivor of civil war, addiction, and homelessness, Hussein now dedicates his life to building recovery spaces. And those spaces bridge faith, culture, and healing across King County. Let's welcome Hussein to the stage.
Good evening, everyone. 13 years ago, I was sleeping on the cold streets of Minneapolis, Minnesota. Today, I stand before you as the founder and executive director of Rama Recovery Center, a place of healing and hope for others just like me. Far from my time on those cold streets, homeless, addicted, and hopeless. I came to this country as a young Somali refugee, carrying trauma I didn't yet understand. I worked hard to succeed. I was a straight A student, the model refugee. But behind that image was a deep pain. You see, in our culture, mental health and addiction are a taboo, things to hide, not to heal. I took my first sip of alcohol in 2002 at a Halloween party in Bellingham, Washington. And that one choice led to 10 years of chaos. I was a functioning addict for a while, holding jobs. I even managed to get married with a home and a son. But that illusion helped me to stay in denial. Denial about my arrest in Alaska for selling drugs. Denial about being detained by ICE for 4 months, facing deportation. Denial about lying to everyone that I loved while dealing drugs in my own home with my wife and my son. So in 2008, my world collapsed. My wife left me while pregnant with our second son. That same year, I got shot, but that didn't even stop me. I was lost, running from my pain through states, shelters, and the streets, surviving only to feed my addiction. By 2012, I was homeless in Minneapolis, Minnesota, arrested for the 3rd time on drug trafficking charges. You see, I wasn't a dealer. I was an addict trying to survive. My public defender told me something that truly changed my life. If you go to treatment, it'll help your case. Motivated by those words, I entered a 28-day treatment program in St. Paul, Minnesota. And on my first day there, an addiction treatment counselor looked at me and said, "Hussein, you're not a bad person. You're a person with a disease called addiction." That was the first time I ever heard those words, substance use disorder. That moment broke me. It broke me open and began my healing. Afterwards, I entered a drug court deferment. I was ordered to stay clean for 1 year and an additional treatment. So I applied to 5-Star Recovery in Chaska, Minnesota for 6 months of mental health and substance use disorder treatment program with a sober living afterwards. There, a therapist helped me uncover the PTSD that haunted me since childhood. The bombs, the screams, the lifeless bodies in Somalia's civil war. I began to heal not only from my addiction, but also from my trauma. After I fulfilled my 1 year of court obligations, my cases got dropped, and I left 5-Star Recovery. I became a town car driver. I was staying sober, rebuilding my life. However, in 2014, I relapsed. Like many who go through addiction, my recovery was non-linear. Terrified, I went back to 5-Star Recovery. This time I did it for me. I faced my demons, embraced therapy, and found strength through faith. While in treatment, I also got my CDL and became an over-the-road truck driver. Those long drives gave me time to think, to pray, to heal, and to rebuild. I have now been in recovery for nearly 12 years. But even as my life improved, I never forgot the barriers I faced, the lack of culturally aware programs, the shame and the stigma in my own community. That is why I founded Rahma Recovery Center, to give my community what I never had, a space that honors culture, faith, and recovery. Our flagship home, Salam House, became Washington's first accredited Level 2 culturally responsive sober living home for East Africans and Muslim men. We provide dignity, safety, and belonging to men in recovery. We host Narcan trainings and address substance use disorder and mental health stigma in our own communities, and partner with community organizations like Living Well Kent and the Somali Health Board to create healing rooted in culture and understanding. But the truth is, we are struggling, not because the need isn't there, but because culturally grounded programs are still underfunded and overlooked. Help cannot be one size fits all. Traditional systems are failing communities like mine. Our Salam House model is a proof that recovery is possible when systems work together with compassion and cultural understanding. I am living evidence of what happens when justice, treatment, and therapy align. There are thousands like me still waiting for that chance. Let us make sure behavioral health care in King County reflects all of us, our cultures, our languages, our humanity. Thank you.
The bright side of addiction is recovery. Hussein embodies that. Thank you, Hussein, for sharing your incredible journey into recovery and helping others in your community find their own path to recovery. Next, we're going to hear from our state legislators, some more of them, and county council members here on stage. We're going to pass around the microphone and again ask folks in the second row to introduce yourself and then respond to one of these questions. What are your thoughts on something that you've learned here tonight? And what are your behavioral health legislative priorities for 2026? And we will begin with Sunshine Cheng, representing Daria Farver's office. Sunshine?
Hi, my name is Sunshine, staff director at Barbar in the 46th District, so Northeast Seattle. I've been working with Representative Farvar for about 6 years now, and when I met her, I was someone whose life had been profoundly impacted by mental health struggles and substance use. And last year, I had the honor of attending this event for the first time, and I remember listening to the speakers' stories and thinking that there was a time when I never could have imagined being alive to sit in that seat. And listening to the stories that we've heard this evening, I feel that way right now. And for anyone who can relate to that story, I'm glad that you're here with us. I'm so proud to be supporting Rep. Farvar, and she looks forward to continuing to protect access to culturally responsive care, care that isn't one size fits all, and deliver services when and where we need them.
Well, hello everyone. Really great to see you all here today. My name is Usman Salahuddin. I'm a state representative from the 48th Legislative District, which is Bellevue, Redmond, Kirkland, and the Points communities. And I do just want to say it's such a privilege to have heard Hussein's story and what he's been able to do in our communities. I have the honor of serving as the first Muslim ever in the House of Representatives in Washington. And thank you. And he hit the nail on the head when he said that talking about behavioral health, talking about recovery, in our culture, in our community, it has been taboo. And what my focus, what I know so many of our legislative priorities and so many of your focuses are making sure that that taboo no longer exists in our communities, focusing on culturally responsive care, focusing on care that embraces the humanity of what we each bring to the table. And so I am committed to fighting for that, not just in the legislature, but with all of you in community. And I'm really excited to continue this conversation moving forward. So thank you.
Thank you. Representative Burnett.
I'm going to stand up next to my colleague here that has much nicer hair than I do, and I'm a little jealous of. Serving the 12th District, which is most of Chelan County, I actually reside in Wenatchee, and we come all the way over Highway 2, Stevens Pass to Monroe, across Duval, Carnation Valley, Snoqualmie Ridge, and North Bend, covering parts of King County and Snohomish County. And you're going to see that the commonalities are that. Doesn't matter where we live in Washington State, but you could fill the seats here from people from Wenatchee and Chelan County, Monroe and Snohomish, all over King County, and the commonalities are just that. But the personal stories are quite selective, and what I've learned here tonight, Hussein, Juju, is you have a story to tell that can motivate others. Don't be ashamed of your past, but be proud of what you've done and the people that have helped you, because now you can turn around and assist those that need the help. Some of my 2026 priorities that I don't know that I'll accomplish those, I think it's going to be a journey for as long as I serve, and I hope that I have the privilege of serving this district for quite some time, but is to better advocate for the victims. And when I say victims, are you guys familiar with restorative justice? That's something, a new terminology for me that I just recently sat down and actually had a conversation with Matthew Leon today, who's in the Monroe facility for a crime that he did a long time ago. But they identify the victimization of their own family members, of the people that they hurt in trauma, first responders. The point is, trauma goes deep and wide. And we need to do better, not just as legislators and community members and King County Council members, as community members, as family members, to reach out to those that we can actually communicate with, because they're not going to reach out and try to grab that help until they feel safe in an environment. And sometimes that safe person to bring them in might be somebody sitting here at this table, that table, and around. So I hope that I'll be able to partner with both of my colleagues from the Senate and the House to be able to move this forward and make a difference for all those who are waiting for a safe environment, to be able to have somebody come alongside them for the journey that they have yet to make a difference, so they can mentor someone else in the future.
Good evening. I'm Tina Orwell. I have the honor of representing the 33rd Legislative District. I want to say welcome to the 33rd, the beautiful 33rd. You know, mental health has impacted me and my family. I'm a social worker, worked 25 years in behavioral health. And, you know there are times when people have reached out and had the courage to ask for help, and they haven't always received it. And sometimes they're harmed by our system. And so I've been incredibly proud to team up with Senator Dhingra and all my colleagues here on the 988 system. It's a chance once in a lifetime to really redo our crisis services so they're healing, and that people do get the help that they need and deserve. I would tell you, we were, I think, the first state to pass it with the fee comprehensive. We also have thanks to tribal leaders, the first 988 tribal line called Native and Strong. Yeah, it's a beautiful thing. Sadly, there are federal cuts. The LGBTQ line for youth was cut. We had one of the receiving things through VOA, and they were getting, I had 1,000% increase in texts last year. And we know this is a high-risk population, so I know my colleagues around me here are committed to seeing what our state can do to step in and make sure there's services for what is really a really high-risk population, especially our trans youth. I also want to do a shout out to King County. When you look at the 988 and the rapid response teams and a place to go, they are leading the state and the country. And I just want to say great work. We're really proud. The last thing I'll mention is I've met with a lot of students, and they have told me we need three things. We need adults to be comfortable talking about mental health and suicide. We need more mental health in the schools, and it needs to reflect the diversity of the student body. And I can tell you in Kent, we have 120 languages spoken. And so we are working with our community-based organizations. I know Valley Cities is here tonight, and hopefully CMAR, and we're making sure that we're trying to team up so that not only the students but the families get the services they need. So thank you for being here tonight. It's amazing. Thanks.
We said we kind of feel like we're on a school bus today. I'm sitting up here. My name is Claire Wilson, proud to represent the 30th Legislative District in South King County. Woo-hoo! Hi. You know, protection is the name of the game for me. I chair Human Services in the Senate, and it is all things child welfare, juvenile justice, corrections, basic needs, food, shelter, and clothing, all discretionary income. And as we think about our budget crisis right now, those are things that put people out in the margins even further out and put them in a position of often doing things that put them in harm's way and put them in systems they should never be in. The other issue for me, K-12, I vice chair K-12, so early learning in K-12 is critically important as we think about family systems. And then we have to think about who's not here, and those are young people in our juvenile justice system and adults in our correctional system who deserve not to criminalize mental health or behavioral health issues or addiction issues, to get the services they need and they deserve in order to be contributing members of our community. And again, it is our situation that often is putting them in the positions that they're in. So we'll continue to fight in every role I'm in on behalf of those who need and deserve those services, especially when we're struggling from the inside out, and also right now with the federal administration from the outside in.
So I now want to talk about how important it is to have continued state partnership in support of our behavioral health workforce. We all know it takes people to treat people, and our community agencies cannot provide care without a robust workforce. We know that current Medicaid rates do not cover the true cost of care. I just lost my place. We know that the current Medicaid rates do not cover the true cost of care, including appropriate compensation for our workers. King County is asking the state to continue funding to complete the behavioral health comparison rate study that will inform fair and future payment levels for key services like counseling, residential treatment, and peer support. To maintain and improve access to behavioral health care, Medicaid reimbursement rates must keep up with the cost of care and be high enough to attract and retain our workers. Even if funding for rate adjustments isn't available right now or is limited in the near term, we believe that completing this study will set the course towards workforce stabilization and continued access to the services that support recovery. The behavioral health sector also needs support to grow and diversify the workforce through strategies like tuition assistance, paid internships, and teaching clinics. These investments assure that more people can access the education and training they need to provide high-quality behavioral health care. We ask that the state join King County in supporting innovative approaches to grow and retain needed behavioral health workers. And then our final behavioral health legislative priority is protecting permanent supportive housing that is threatened by the federal government. Permanent supportive housing provides critical housing paired with services and supports to individuals with mental health and substance use conditions. We all know how stable housing is fundamental to a person's overall health and well-being. Here in King County, we've seen firsthand what's possible when people can get the treatment they need in stable supportive housing environments. For example, within the first year of moving into a health through housing building, residents experienced a 17% decrease in emergency room visits and a 33% decrease in hospital stays. Yeah, it works. But imminent federal cuts and a campaign to discredit permanent supportive housing is threatening a program we know works and supports the long-term health of residents. To protect existing programs and help people get and maintain the housing they so deserve, King County is asking the state to create flexibility for the state's homelessness services funds, which support permanent supportive housing operations, the rental assistance, and the supportive services. We also ask the state to maintain investments in mobile behavioral health teams that bring care directly to people in supportive housing or individuals experiencing homelessness who are in the need of care. Having a stable, safe place to live is critical to recovery. This is the type of progress we must protect and invest in across the county. So with that, I'd like to introduce our final recovery speaker of the evening. Please help me welcome Rocket Garcia. Rocket is a 26-year-old artivista. She is both an artist and an activist. Through her love of the arts and working with community, she advocates for indigenous sovereignty, ending homelessness, and juvenile justice reform. Rocket brings a courageous and insightful perspective on trauma, healing, and recovery. She is proof that healing and transformation are possible. Please welcome Rocket.
My name is Rocket Garcia, granddaughter of Martha Maldonado of the Hopi and Taino, and I have struggled with mental health for as long as I can remember. As a kid, I missed a lot of school and frequently complained of stomach aches, which I now know can be how children express that they're anxious. I cried a lot, so much so that my peers referred to me as the girl who cries for no reason. I was always reading, drawing, or playing outside where there were fairies, magic, fantastical creatures, and I didn't feel so alone. I was one of those kids waiting for my Hogwarts letter, a white rabbit, a tornado, anything to transport me to a magical place away from the isolation, couch surfing, and frequent sexual and psychological abuse. Around 8 years old, I began to experience something that I called the pulling. I would lock myself in the bathroom and lay on the cold tile floor as a horrible dread seeped in. It felt like I was being pulled apart from the inside out, holding myself back from thrashing and screaming because I couldn't let the people we were living with hear me. As I grew from child to adult, I found that there were no fairy circles or portals to escape through. My behavioral health issues grew worse as I experienced more intense traumas and my unhealthy coping skills escalated. Because my abuser groomed me to have no boundaries, privacy, and to not trust my intuition, I became an easy target for other predators who took advantage of me. I tried to control my life through eating disorders, improve my self-esteem through sex addiction, and chase euphoria through passive suicide. My biggest challenge has been my amnesic barriers. There were large pieces of my life missing from my memory. I had developed serious dissociation because of my continuous and severe childhood traumas. I was damaging my relationships beyond repair, missing classes and work, and in general, struggling to get my life started. The fall before my 25th birthday, I started having something similar to a quarter-life crisis. Up until that point, everything I did was to try and numb myself from my thoughts, memories, and experiences. I turned around, looked at all of my problems, and said, "Just what the heck is going on around here?" I could no longer ignore how sick I was from my combination of meds and overworking. So I applied for short-term disability, and for the first time in my life, I sat with myself and really listened. At that time in fall of 2023, my worst nightmare was the thought of my abuser dying. I didn't want to feel helpless anymore, and I needed to believe that I could survive on my own. But in order to do that, I had to accept that my abuser was not my savior. I was the only one who could save myself. I'd been friends with a guy named Jonas for a couple of years. We had met while doing activist work together in LA. We were both in rough living situations, so we put our heads together and made a plan to escape California. While doing so, we fell in love. For the first time, someone was helping me to keep track of my dissociation and memory lapses. He encouraged me to write things down, to talk aloud to myself, and to use grounding techniques. I was able to start piecing together the truth. I didn't need my abuser. They needed me. There were times in the coming months that I didn't think I was going to make it out of California. My abuser did everything in their power to keep me from moving, including taking my car. People showed up to my house unannounced, begging me not to leave. But in January of 2024, Jonas and I made it here to Washington. It was a little bit of a rocky start, but we figured it out. You can clap. It was impactful. I took steps towards self-sufficiency by learning about what resources were available to me. I took the bus every week to Pierce, Seattle, where a peer helped me reach my goal of housing stability. Jonas is a former foster youth, so together we were able to use the FYI housing voucher. I began prioritizing and taking charge of my health by getting Apple Health, EBT, and ABD. Because of this, I'm back in therapy, which is helping tremendously with giving me a safe space to grow and heal. When I look back on my memories from before, it feels like a different life. Part of my recovery is affirming to myself that I am safe and deserve to have the life I do. I deserve to have an incredible boyfriend. I deserve to co-parent a one-eyed cat named Remy. I deserve to have my own apartment where I feel safe to live and be myself for the first time. I deserve to move slowly, focusing on my health instead of being in chronic survival mode. I'm reaching out to people from my past to try to help myself create a chronological narrative of my life. I'm also allowing myself to let go of the stifling narratives that have been created for me. I wouldn't have gotten here without lots of support. I want to thank my ancestors who guided me, the Van Antwerp family who gave me shelter during the pandemic, my dad and Jonas, my mentors Mayra Zaragoza and Kruti Parek, the Mockingbird Society and the Y Social Impact Center, and I want to thank King County. This county has given me indispensable support while I recover and claim the independence I've been fighting for my entire life. There are many things that I've had to leave out of my speech in the interest of time, but just know that it has not been as linear as this. There are multiple times that I tried to leave my abuser, only to find myself back there again with no memory of how. But now that I'm here and in recovery, I no longer have to look for fairy doors. I'm so grateful to have built myself a life that I don't have to dream of escaping. Thank you.
Wow. Whew, that was powerful. Rocket just proves that people with mental health challenges can and do recover. Thanks, Rocket, for sharing your mental health journey with us tonight, and we're certainly glad you found your recovery community here in King County. Next, we're going to hear from the rest of our state legislators and county council members here on stage. Again, we're going to pass the microphone and ask folks in the next row to introduce yourself and then respond to one of the following questions. What are your thoughts on something you've learned here tonight? And what are your behavioral health legislative priorities for 2026? We ask that you take about a minute each. We'll begin with Senator Valdez.
Hi, I'm Javier Valdez, State Senator from the 46th Legislative District. I guess my first takeaway of one thing I've learned tonight, and actually it's been a recurring theme and comment over the last many years, my years as legislator, is more affordable housing. We've heard that over and over again when I was here earlier before we sat here up front and talking to my 46th district table. That came up over and over again. In the 46th district, which is Northeast Seattle, we're doing our best. We're just going to be opening some affordable housing there at the Northgate Transit Center here next year. We're working with the City of Seattle, with the Lake City Community Center coming on board in about 2029. Be the first ever City of Seattle Community Center that actually have low-income affordable housing up on top. And kind of setting the trend there. And I guess the other thing that I've learned, I'm going to shout out to Karen over at Ryther, right in the heart of my district, is that our reimbursement rates still need to be worked on. I know this is something you and I and former Senator Frock, actually my predecessor, worked for many years on, and we've tried to do better. We do a little better, and then we always seem to take a step back, and I haven't forgotten you, Karen. You're always on me, and we're doing the best we can to make sure that we do better on that.
Hi, everyone. My name is Zach Hall. privileged to represent the 5th Legislative District. If you don't know me, I don't blame you. I am the most junior member of the legislature. I'm about 5 months on the job. I was appointed this summer, so I have not yet experienced the thrill of a legislative session. My familiarity with behavioral health policy comes from my background as a city council member in the city of Issaquah, where we used sales tax authority that many members up here gave us authority to use on behavioral health and crisis response in our communities. One of the challenges that we've recognized there and across different municipalities in King County is workforce and recruiting and retaining talented professionals to be able to respond to community members in the way that they need. So I'm thrilled to see workforce on your legislative agenda and that there are levers available to us to encourage that pipeline, and I look forward to working with all of you on that. Thanks.
Good evening. I'm Lisa Callan. I get to represent with Representative Hall the 5th Legislative District, which is East King County, South King County. So Issaquah all the way up to Snoqualmie Pass, just north of I-90, and we go all the way down to the lovely Enumclaw space, so everything in between in that region. It's a real honor to serve. I want to give my deep gratitude to hearing Juju and Hussein and Rocket and certainly Karen and your public-private partnerships in the county. And you're telling your stories, your journeys, and making sure that we're hearing the humanness behind every number that we see, every budget line that we try to move forward, and every aspect of what we think from the legislature makes sense needs to be seen and told by the lives of the people that are experiencing systems that we're either funding or not funding in every way. So just deep gratitude to you all who came up and did that, and to each and every one of you that are here in the room tonight. You are bringing the human factor, the humanness to all of this work. I serve on appropriations in the House, I serve on capital budget in the House, and I serve on the K-12 committee, and I have served on the Human Services Early Learning space. I co-chair the Children Youth Behavioral Health Work Group, which has been a deep passion of mine. So one of these areas, I'm hearing very loudly, right? Recovery's not linear. That help cannot be a one-size-fits-all. Certainly, help isn't help if it doesn't look and feel like help and isn't accessible to help. And that care has to be delivered with compassion and cultural understanding. These are all elements that I've heard from each one of you tonight. My work this coming legislative session will be to continue to move forward the behavioral health needs of our youth and children. We rank by, I think it's in Washington State, thank you. We rank 4th in the nation for child health. We rank 48th in the nation for youth flourishing, which is physical health, behavioral health, our relationships, and our education and cognitive well-being. That's a number. That's a number that none of us want to hear or be at for sure. And what we need to do to move forward and make a difference in that is to make sure that we're connecting all the dots, all the disconnected spaces of where we're treating and working and supporting behavioral health. How does a child, from the moment it's born, how is that child, and how even the predisposition of that child from pregnancy all the way through the transitioning into adulthood to the age of 25. We have a new framework that we've been working on, built off of and heard from and really defined by those that are living and experiencing our system, called Washington Thriving. It just came out a week ago. And it is just the beginning of where we need to go, and it really describes what we need to do in Washington State. And one of those components is really building on the structures of how the state shows up for the counties show up for our communities, how all of us are showing up for the individuals. And so I'm going to be moving bills forward that specifically put that into law, that's the direction we need to go, and we need to speak together, and we need to swim the same direction and make sure that these services are there.
Good evening, everyone. My name is Lauren Davis. I represent the 32nd Legislative District, which is, thanks. Northwest Seattle, Shoreline, and then up into Snohomish County. You know, I stand on the stage tonight really standing on the shoulders of giants, one of whom we celebrated tonight, my longtime friend Nancy Dow, who I affectionately refer to as the OG peer, and one who is no longer here, who has a profound legacy of behavioral health in this state, which is the late former Speaker of the House, Frank Chop, whose hands and heart have shaped the system. This is the first legislative forum we've had without him, but his legacy will continue to live on. Turning to next year, I'll just mention 4 priorities very briefly. We heard about the need to preserve and stabilize, in many ways, our behavioral health programs and infrastructure that King County relies on have been under attack, so to speak, because of the state budget shortfall. One program that I'll mention in particular, which is the Recovery Navigator program, the statewide expansion. It's the statewide expansion of the LEAD model, but that is a primarily and soon to be exclusively state-funded program. We nearly lost it last year. The Senate budget actually eliminated the program, and we were fortunately, thanks to the heroic efforts of Rep. Macri up there in the front row, we were able to preserve it. But that's concerning, and so we need to help collectively educate and make sure lawmakers understand the importance of these programs. You heard a lot about the need for revenue in general and progressive revenue. I'm also interested in targeted revenue, so things like an opioid impact fee, which has been passed in other states where we use a per milligram morphine equivalent fee that's levied on opioid manufacturers, for an example, to generate targeted revenue for these services. I was reminded tonight about the urgent need to continue work to address the scourge of high-potency cannabis. I met a mom tonight, one of many moms that I've met, who has an adult child who had THC-induced psychotic disorder and now lives with schizophrenia. I think you're all aware, a diagnosis for which there is no cure. So continuing work on that. And then finally, I do think our state's Involuntary Treatment Act needs some continued reforms. And most pressingly, I just received data actually from this county that of 800 attempted detentions in the community, so not in the emergency department, 380 of them, nearly half, were not able to be effectuated because of concerns about coordination with law enforcement, and that is not because law enforcement is not very eager and willing to help. It is because our statutes have been very unclear about what direction we were to give law enforcement and what support and protection we will provide them when we ask them to step in and save lives, and there have been some really tragic outcomes as a result of those non-detentions, so hoping to work on that as well. Thank you.
I'm Senator Bob Hasagawa from the 11th Legislative District, which is Tukwila, Renton, Kent, and parts of unincorporated King County. So first, I guess I want to thank Hussein for putting a spotlight on culturally appropriate access to services and provision of services, because, you know, that my wife, I got to give it to her. She hammers me about this constantly. She spent decades serving in the behavioral health administrative services in San Francisco and Pierce County and Benton, Franklin County, Human Services and all that. So I am not an expert, believe me. She is, so you all are in good hands because she controls the strings. What I wanted to talk about a little bit was, you know, you want to know what I'm thinking about. What I'm thinking about is the fabric of society seems to be ripping apart right now. And what happens when that, to all of our families, to us as individuals, when the pressures of society continue to build and build and build, we're going to see increases in the need for behavioral health services because we're all trying to adapt and figure out how do we live in this new changing world where there's so much insecurity around where am I going to eat, where am I going to sleep, am I going to be able to go to the doctor if I need to. You know, there's so many insecurities that are piling on top of each other. It's going to see a huge, I see, increase in behavioral health needs, services needs, until we actually get this ship turned around. But there's hope. We need because these crises also provide us the opportunity to look at systems changes, to really prioritize those things that are most important to us. And behavioral health services help us be the best people we can be. It's a basic human need to try and allow all of us to become the best people we can be. If we're not living our best lives, you know, there's something wrong with society, and that's what behavioral health services needs to provide, is access to those things so we can live our best lives. But that requires funding, right? And I thank you for acknowledging that we're in a difficult budget year so that you don't have multi-$100 million asks for this budget cycle, this supplemental budget. But the money is out there. Let's face it. We're in one of the wealthiest cities and regions in the country. The money is out there, but society has shifted. Our values seem to have shifted where we're idolizing billionaires and trillion-dollar corporate. Elon Musk just signed a trillion-dollar wage package. Can you believe that? A trillion-dollar wage package. Money is there, but they forget who made that money for them. It's all of us sitting here, and many of us who are suffering because we're carved out of that system. So when we think about funding, we need to consider comprehensive progressive tax reform, including, I would say, an income tax, a progressive income tax. That is considered the deadly third rail of politics. They talk about that as being the deadly third rail of politics, but let's face it, what we got ain't working. And unless we take a systems change view of this, we're going to continue on this downward spiral. So we have to do something, but the good news is the opportunity is there now for us to do something. So I'm going to make an ask of all of you out here. This is a call to action. We can't do it as legislators by ourselves. We need the political will of the people to make this change. So go back to your organizations, your community-based organizations, and say, we have to raise new revenue, not from the poorest who can least afford it, but from those who are gaining the most out of what society has to offer, and turn that back into society so that all ships rise at the same time. So that's my ask of you all. I hope you make a commitment to go out there, get involved with your other organizations that you are linked with, networked with, and start talking about the need to start reforming our revenue system so those who can best afford to pay do pay the most. Thank you.
So I want to close with this, just one thing. Those who know me well know that I absolutely love musical theater. Typically at this time, I'd probably pull out some pithy quote from the musical Hamilton, because I firmly believe that there is a Hamilton quote for everything that happens in life. But this year I had the privilege to see a musical called Suffs. It's about the suffragist movement and the trials and tribulations of fighting for a woman's right to vote. But even as the suffragists, spoiler alert here, actually achieved the right to vote, they realize that the work doesn't end and there is still so much more to be done. It's that theme and the last song of the musical that has really stuck with me throughout this year since I've seen it. And as I reflect on what's happening, on how far we've come and how much further we have to go. In the very last song, they remind us that when you're trying to create change, the path will be twisted and risky and slow. That we may at times fail, at other times we will prevail, and there is so much to learn from both our successes and our mistakes. And especially they remind us, and I quote, that progress is possible, not guaranteed. It will only be made if we keep marching on. And that is what I implore all of you to do tonight and going forward. Change will only happen if we continue to work together in partnership, advocating for the change that we seek, and not stopping, even in the face of what feels hopeless and insurmountable. Thank you all again for joining us for this fabulous evening, for affirming that recovery is always possible, for speaking up, for listening, and for working together to protect and improve behavioral health for all of King County. And remember that progress is possible, but it is not guaranteed. So let's all keep marching on together.